Welcome to Moms Every Day, helpful hints for a happier home.
Welcome to momseveryday.com. Joining us is Dr. David Gochner with the College Station Medical Center. Today we're talking about heartburn. During the holidays we tend to eat a lot and a lot of different foods, and most of us have experienced heartburn, but what actually is it?
When people experience heartburn, what's happening is the acidic contents within their stomach regurgitates in their esophagus, and that lies right behind the heart, hence the term heartburn, because it burns.
Okay, other than burning, what are some of the other symptoms?
Other symptoms might include regurgitation of food products. That can lead to chronic coughing, chronic pulmonary infections, or even dental erosions. And a lot of people experience actual chest pain.
Okay, if we're experiencing some of those symptoms, what can we do to alleviate them?
Well, some lifestyle modifications would be to eat smaller meals and more times during the day, avoid trigger foods such as rich or fatty foods, spicy foods. Try to sleep with the head of your bed elevated, maybe 4 to 6 inches. And probably the biggest thing is to not eat within about 40 minutes of lying down to go to bed.
Wow, some good information. When does it become a problem? When should we see a doctor?
Well, a lot of people do suffer from heartburn symptoms occasionally, right? So if you eat a big bucket of chili cheese fries and a bunch of soda, then you may have heartburn and indigestion. But many people experience this almost every day or 3 to 5 times a week. When your symptoms are severe like that, then you probably ought to see a doctor to be screened.
Because what is the difference between heartburn and, like, for instance, GERD?
Well, primarily it's differentiated by the amount of symptoms people have. But the problem with GERD is that the chronic exposure of your esophagus to the acid can lead to things like Barrett's esophagus, which are changes to the esophagus lining, and that ultimately can lead to cancer, which can be very dangerous.
Yeah, absolutely. Okay, if you would like more information about heartburn, you can just log on to momseveryday.com/BCS.